Alright, so my name is Brian Gonzalez, and this is Anatomy and Physiology 1. So I'm going to explain the difference between anatomy and physiology. Anatomy and physiology are kind of similar, but they are a little bit different in certain ways. Like anatomy is the study of the structure of the body. It basically includes the organs, tissues, and cells. Um, Physiology, on the other hand, I would say is kind of the structures like the blood circulation, the nerves, the muscle contraction. So to kind of sum it up, anatomy describes what structures are present, while physiology kind of explains on how they work. So I have my model here. This is my friend Maria. I'm just gonna explain the anatomical directions. So superior is going to be towards the head. The head is superior to the chest, so up and down. Inferior is towards the feet, so the stomach is inferior to the heart. Anterior is the front side. The sternum is anterior to the spine. Posterior is the back side, so the spine is kind of just posterior to the heart. Like split through. Medial is towards the midline. From the nose is medial, like kind of to the eyes. Lateral is away from the midline. The arms are lateral to like the chest. Proximal is closer to the point of attachment, like the elbow is proximal to the wrist. Distal is farther from the point of attachment. The fingers are distal to the elbow, so up and down. Superficial is from close to the surface, like the skin is superficial to the muscles. Deep is pretty much further inside the body. The bones are deep to the muscles. So my next topic is I'm just gonna name the anatomical regions of the body. Um, so this one's a little hard to pronounce, but cephalic is basically just the head. Cervical is gonna be her neck. Thorax is the chest. Abdominal is just her abdomen. The pelvic is the pelvis. The upper limbs are basically just gonna be like her arms, forearm, and hands. The lower limbs are gonna be thighs, legs, and her feet. And then the back is dorsal region. I'm gonna kind of explain why they're important. So I feel like mostly for like clinical reasons. I feel like so like for communications, like the terms kind of ensure that the healthcare workers can communicate like efficiently, I guess, and avoid any errors. So I know most like medical imaging, diagnostics, like basically doctors use directional terms and regions to describe findings in X-rays, CT scans, and MRIs. Surgical precision, like in surgery, I guess they use that. They use a lot of these terms. Medical assessments, like when they're laying, like patients laying in a hospital bed, and they don't know which way they're laying or what the pain's coming from. Um, so pretty much in conclusion, anatomy, physiology, and sciences are sciences in medicine, while anatomy focuses on structure and physiology explains the function. The anatomical position, directional terms, and body regions provide um, that's crucial in healthcare. These concepts pretty much ensure the communication, accurate diagnosis, and for patient care. Um, so this is my explanation on how anatomy and physiology differ from each other. I explained the anatomical positions and why they're important. I also went over the anatomical directions and terms, like explaining the head, neck, and then I also gave a summation of the anatomy, physiology, why they differ, and why it's important. That's all for my video. Thank you.